Members of the high table, I was not here when the order of protocol was established, so I will stand on it. But the most important table is the audience here. Can we put our hands together for everybody here? Please go ahead. The most important table. Most important table. I know I've been invited for this event. My team told me that I was supposed to be here for this event, and I didn't want to come initially for two reasons. Because I told the organizers that I don't want to be decorated as any patron of anything, because I really have not contributed in any means to this organization. At least you decorate someone who has, contributed or made an impact in one way or the other. But now I may deserve it, because I really hope to contribute to the growth of this noble forum. And the other reason was also because, like the compare rightly pointed out, that I've joined partisan politics. Hello, put your hands together for me now. so I can now be called a politician, and this is the season for politicians. So you have a scholar in politics. So let me start by introducing myself. I know many of you have not seen me before. If you have seen me before, can you indicate with the raise of hands? Oh dear, I'm in a hostile audience. Okay, that's one there, two. But if you're ahead of me, can you put your hands up? Okay, all right, no problem. So let me reintroduce myself. My name is Chima Amadi. I am from Ekwune in Ngoba, the local government, just across there. Yeah. And I am a scholar, like I said. I am also a trader. So I do business, because sometimes, the take-home package for those of us in the knowledge industry does not usually, it stops us on the way. so we try to, do some side hustles from time to time to make ends meet. So one of my side hustles is buying and selling. And now I have joined politics. My sojourn in the knowledge sector, I started first as a scientist. So I started my stint in the University of Ibadan as a human nutritionist. My first degree, which I studied up to PhD, taught briefly in that side, and took a detour to the social science, where I went in to bag a degree in politics and international relations. So as not to bore you, I cumulatively have about 9 degrees, 2 BScs. Thank you. As two BScs, 5 master's degree, and 2 PhDs. The University of Ibadan, like I mentioned, some of you here will know that that is the only university in Nigeria, with apologies to any other person that has gone to any other school. I also be privileged to go to the London School of Economics, the University College London. Currently, I am a research fellow at the University of Warwick in Coventry. So when I saw this, that this has to do with the Medical Laboratory Science Forum, I said I'll be here because, like I said, with a degree in public health, I think I should know 1 or 2 things about what this forum is trying to achieve. And when I was told that there was a competition that had to do with, I think, AI, am I right? Did that competition eventually hold? Yes. Good. It held. So I was told that there was a competition, and the theme, I said, yes, I needed to talk to this young audience about the daunting task ahead of them. And I was told that one of the topics, I think there are 2 topics. One is artificial intelligence. And so, who best to discuss these ideas, these what I call emerging ideas, than someone who is aspiring to maybe play in the political field? So I'll start first by saying that all of you here are either medical laboratory scientists or aspiring to be one. Am I right? Yes, sir. Am I right? Yes, good. Now, the future of that noble profession, the medical laboratory scientist, is no longer about reagents and microscopes. You know, when you go to laboratory, you see reagents here and there, right? In today's world, it's no longer about that. It's now more about algorithms, predictive diagnostics, precision data gathering, intelligent systems, and what I call assisted designs. That is the truth. I also want to say that I know many people fear artificial intelligence, AI. One of the fears of artificial intelligence is that, people will lose their jobs, right? So I want to tell you that artificial intelligence cannot replace medical laboratory science. But medical laboratory scientists who do not learn artificial intelligence will be replaced. Yes. So what is AI? Anyone want to help us? What is AI? Anybody? Come on, let's make this interactive. What is AI? Yeah, so define artificial intelligence. Somebody wants to help us, please pass the microphone. Let's make this lively, okay? Let's interact. This is a gathering of intellectuals.
It's a software program device that accesses data and processes data and give it out as results.
Please bring it further.
I said AI, artificial intelligence, is a program software device that processes data, analyze data, and bring it out as a result for diagnosis.
Please put your hands together. It's a brilliant. My brother, what's your name? Okay, student?
Yes, sir.
All right, I'll come back to you. Simply put, what it basically says that artificial intelligence are computer systems that does 4 main things. If you listen to what it says, 1, they analyze data, right? Now, in medical laboratory science, you deal with a lot of data every day, right? Who has seen a medical laboratory results be full? You see all the data you have to pour in, right? All kinds of data. Some people call it jargon. You deal with data. Sometimes you hear doctors say, the results has not come, it has come in. We are studying it. When we finish studying, then it takes some days, right? With AI, it just happens at the speed of light. The results comes out, it interprets it, and a decision can be taken at the speed of light. That is what artificial. So you find out that rather than attending any facility that has AI installed capacity, rather than attending to maybe a few customers a day, you can attend to hundreds in a very, very short time. Am I making sense here? Yes. Good. Now, already in places where there is sanity in the healthcare sector, AI is already being used in certain fields. Hematology, for example, is using AI. Am I right? Yes, sir. Good. Histopathology is using it. Who knows what histopathology is? You know what that means, right? Yes. Cancer cells and all that. The microbiologists are also using it. For those who do normal tests for every day. Clinical chemistry too, they're also using AI. Molecular diagnostics, right? Yes. We are familiar with these terms, aren't we? Yes. Brilliant. So, like I said earlier, the advantage of using AI is simply because you have faster turnaround times. I just told you now that, you are using it, you don't want to waste time, turn around quickly, press a thing, it's fast. So queues and waiting for results, especially in situations where the patient needs results at very, very fast for decisions to be made. Especially in situations where the patient cannot just have the speed of the time to waste for a decision to be taken. Incorporating AI helps that for us to reduce time, take decision, and begin, the process of healing. Is a waste. But more importantly about AI is about improved accuracy. Sometimes many of our laboratory results are tainted by human error. The accuracy level of AI is far, far higher. You can simply say that the inclusion of AI in medical laboratory diagnostics and science can only be a good thing. It also helps in quality assurance. Do we know what quality assurance is? Good. And the challenge is that the thing is simply too expensive. Right? Simply too expensive. And where it's available, then there's a question of manpower. Skills. Simple skills. You do have the skills. And where you have the skills, will bureaucratic bottlenecks even allow government agencies or government hospitals to acquire them and put them to use? And even when these things are there, what about the supply side economics of poor infrastructure? So you come and the administrator, are you with me? Or there's no fuel in the to power this and that, So these are problems, especially in developing clients like us, where it is becoming very difficult now that we have seen the advantage of incorporating AI in medical laboratory science. But the advantage is far outweighed by the costs and the infrastructural challenge that we have. And even training. How many of our tertiary institutions today have the capacity to train the next batch of medical laboratory scientists in AI? These are all issues that we need to reflect about in this. However, I believe that some of these challenges can be overcome with what I call responsible leadership in the polity. And that is where politics comes into this. The public sector will have to necessarily take up the charge. Because again, how many private sector hospitals, especially as Nigeria is, can afford to incorporate this? Let me give you an example. There are some machines that you need in the health sector that I assure you are so expensive that, especially for example, the MRI scan machine. You know that, the MRI scan? So expensive that very few private hospitals can afford to have them. But government hospitals can afford because government has the capacity and the finance to do that. Where there is prioritization in government and where there is a will to, do the right thing. The right quality of leadership is all you need to ensure that these beautiful things we have talked about happen. So, as we get to another election season, as you have agreed with me that poor leadership, or if you elect very poor or people who don't understand these concepts, what you have is people who will focus. I would rather you give me a 20-bed hospital that has everything, the infrastructure, the equipment, the manpower, everything, than giving me a 500-seater just for aesthetics and to show that you have built a big hospital. Wouldn't you prefer that? I would rather that you equip the universities and technical schools with the right capacity to train the medical laboratory students to become adept at the latest innovation, the innovations, for example, AI, train them. It enables decisions to be taken at when due. So why give me a flyover that at the end of the day, a fraction of that money into equipping our schools and our hospitals to have the ability to save lives. But you can also do yours. And what you can do is by ensuring that you help elect the next set of leaders who can bring the change that we all deserve. So I ask a simple question. How many of you have your PVCs? You see what I mean? If you have your PVCs, can you show? Raise your hand. Professor, I'm very sad to report to you that 70% of the audience here do not have their PVCs. And yet, you are going to be mad that the government is not working. You are going to be angry that government is not doing what they have to do. Are going to be the first persons to be the victims of bad government. You are going into a world where your peers out there at a very young age are conversant with AI and its features. Yet you are still dealing with the anachronistic way of things, of doing things. And the opportunity you have to effect change, to ensure that things are done the right way by putting in people or putting in place a government that can affect your life. The only tool required of you, which is your PVC, 70% of you do not have it. And you want to leave the decision for your future in the hands of those who do not understand what AI is. This is a sad development. I want all of you now to take politics very seriously. If you have not registered, please go back and register. The new Nigeria that we are trying to build belongs to all of you. To you and you and you. Do not leave it in the hands of mediocres. I beg you. I know that what is the trend right now is Japa. Let me just finish, get my and Japa. Let me tell you something. There is nothing like home. Even the place we are Japa into, those countries are making it difficult for you to come over there. Very difficult. If your government does the right thing, I assure you that the best place to work, earn a living, and even when you want to go out, you don't even stand the chance if you are ill-prepared or ill-trained. But if you are well-trained, even when you want to Japan, you go there standing a chance. As other nations are putting in place these facilities for their next generation. So please, take politics very seriously and register and make sure that you cast your votes. But more importantly, even when you don't have the training, try and develop yourself, train yourself. All right? AI is here with us. The world is moving faster and they are not going to wait for Nigeria. Do you understand what I'm saying? They are not going to wait for Nigeria. They are not going to wait for you. Do that. And my prayer is that by the next time we'll be having this forum again, we'll be saying that everybody has their PVCs, everybody here is now doing one kind of training or the other in AI, and everybody is equipping themselves or developing themselves with the skills to be better in your field. I want to thank you for listening to me. I want to thank you for the opportunity. My name is Chima Amadi. I'm of the APP, and I'm running to be the next senator of the Owerri Zone. God bless you and thank you.
Thank you so much, sir.
I just want to make a little contribution to the competition. I saw some prize that you have outlined for the winners. There was 100,000 and there was, what is that it? 50, 30,000, 20, and 20,000. So I want to increase it a little. Is that okay? Do I have the permission of the chair? So for me now, the first prize will now be 500,000. The second prize will now be 300,000. And the third prize will be 200,000. Let me 2 million. And for the young, what do you call it? The young scientists that are gathered here, I will give you 1 million naira. Share it amongst them. Let it be a little something to transport themselves back home and to think about our little lecture today. God bless you.